So next we will see in acute respiratory distress syndrome what are the clinical manifestations, diagnosis and management. Early signs and symptoms are restlessness, dyspnea, low blood pressure, confusion, extreme tiredness, change in patient's behavior like mood swings, disorientation and change in level of consciousness. If pneumonia, in case of pneumonia, patient will have cough and fever. Here the signs and symptoms, it depends on the hypoxia and restlessness, this confusion or mood swings, change in patient's behavior. All these things are due to decreased cerebral perfusion or decreased oxygen supply to the brain cells. Okay. Then in case of pneumonia, that is infection, so the patient will have high grade fever and also cough. Then late signs and symptoms are severe difficulty in breathing, that is labored breathing and also rapid breathing or tachypnea. Labored breathing means accessory muscles will be used for breathing. Then shortness of breath, tachycardia will be present, cyanosis, that is bluish discoloration of skin, lips and nails, you know that. Then patient will have pink frothy sputum. Then it can lead to metabolic acidosis. In case of severe condition, late sign is metabolic acidosis. Abnormal breath sounds may be present. Example is crackles. Then decreased PaCO2 with the respiratory alkalosis and decreased partial pressure of oxygen. It depends on the stage and severity of disease. Respiratory alkalosis or metabolic acidosis can develop. Then what are the diagnostic investigations? Definitely first one is history of the patient, any lung injury, to identify the cause, history should be taken. Then clinical manifestations should be assessed, symptoms should be assessed. Then on physical examination, auscultation reveals abnormal breath sounds, that is crackles and rhonchi, which are the abnormal breath sounds, isn't it? Then intercostal and suprasternal retractions may be present, tachycardia, diaphoresis, cyanosis and pallor. Okay, then other investigations are ABG, that is arterial blood gas analysis. Then other blood test for a complete blood picture, CBC should be sent. Then chest x-ray. In chest x-ray there will be diffused extensive bilateral alveolar infiltrates. Then bronchoscopy, sputum cultures and analysis to see the cause or whether it is related to a bacterial infection. Then other tests are chest CT scan and echocardiogram. Then management. Persons with the ARDS are hospitalized and require treatment in the intensive care unit. If we are suspecting ARDS, in that case definitely the patient should be transferred to intensive care unit because the condition worsens very fast. So continuous monitoring is needed for such patients. Those who present with the SpO2, this pulse, using pulse oximeter we can check the oxygen saturation, and if it is coming down, then the patient should be shifted to ICU. No specific therapy is there for ARDS, but supportive therapy is usually given. In addition to management of acute respiratory failure, patient with the ARDS requires supportive therapy, respiratory therapy, fluid therapy, nutritional therapy and drug therapy. Supportive therapy, it includes identification and treatment of the underlying cause. If it is bacterial infection, antibiotics should be specific, antibiotics should be administered according to the cause. We have to identify the cause and treat the cause. Then hemodynamic monitoring. Continuously we have to monitor the status of the patient. Hemodynamic monitoring may include all the invasive, non-invasive as well as invasive, like a pulmonary artery pressure, such thing as CVP. Those parameters should be monitored, and also continuously we have to monitor the cardiac function. ECG should be monitored, and also this pulse, BP, all vital signs should be monitored. Then maintain cardiac output. In order to maintain cardiac output, inotropes or vasopressive drugs can be administered, like dopamine and dobutamine, and also administered diuretics, because patient will develop pulmonary edema, and severe breathing difficulty will be present for these patients, so diuretics should be administered. And also fluid therapy should be, or intravenous fluid also should be administered to maintain cardiac output. And then the nutrition, parenteral and enteral nutrition according to the condition of the patient, it should be provided for the patient.